Your name and where you from?
My name is Do Young, and I came from Korea, South Korea.
How many years ago you came here?
I came here 2010 to study abroad to the United States.
Which school did you go to here?
I went to the University of San Francisco.
Oh, okay.
But first of all, I came here for community college in Redwood City. It's called Cañada College.
Oh my God!
Really? Like, you know that?
I went there.
Oh, really?
Yeah, Cañada and then College of San Mateo.
Yeah, right. They're all really they're the sisters.
In Skyline.
Yeah, Skyline.
Oh my God.
So I graduated Cañada College in health science, and then transferred to the University of San Francisco, and then study 4 years here because there's a curriculum I have to follow.
Okay.
So starting from the freshman again, and then and graduated on.
Are you from the Seoul?
Yeah, I'm from Seoul.
Okay. So you've been living in the U.S. how many years now?
So I came here 2010, so like 10 years.
10 years.
11 years. Starting 11 years now. Yeah.
Okay. Do you have a family in the U.S. or Korea?
No, everyone in Korea.
Okay.
I came here by myself, but later on, my younger brother came to U.S. to study also, but now he's in Korea in military.
Oh, that's right.
Yeah.
So that's right, because the military program in South Korea, that's like 100% you have to do, right?
Yes, it's mandatory.
Okay. When's the last time you visited Korea?
Actually, last year. Actually, last year.
Oh wow, lucky.
Yeah. With the COVID situation, I went around like when was it? Last summer I went there, but it was the like 3 years. I didn't go to the Korea like for 3 years, and then the last year was actually like happening before. I was just thinking like, okay, so this is kind of best time to go to Korea. It's getting worse or something. Or
so you went like early beginning of the 2019.
20.
Oh, 2020.
Yeah, 2020.
Oh, wow.
So,
Okay.
On June-ish,
June?
May or June, I went there.
Oh wow, that's kind of surprising. Okay. The Sequoia is the first job?
No, so after I got my nursing license, I went to another skilled nursing facility, which is San Francisco Healthcare and Rehab. It's in the Grove Street. I study over there. I work over there a couple of years, almost couple to 3 years, and then as a nurse supervisor over there, and then I moved to the Sequoias after that.
And your position here is?
I'm a nurse manager here in the health center, Sequoia, San Francisco.
So I shouldn't say how many years, how many months you've been working to Sequoia.
Yeah, I just got 3 months.
So just 3 months?
Yeah, actually today's maybe the 3 months. Just because I started my work as week of the Thanksgiving, so it's actually 3 months.
Wow. Feels like you've been here for a while already, which is a good thing actually. What is the most difficult thing since COVID-19 started? For you, first of all, actually for you.
For me, is just like we kind of lost our normal life. That's the most difficult thing. But right now we're starting as a new normal, wearing a mask every day. But I already missed the life without the mask, and then just like just living like a free, you know. But right now, because of COVID, there's a more restriction about because my family in Korea. I'm planning to get married in this year. So, yeah. So the problem was like if there's no COVID, maybe I already went to the Korea and then already got married. But because of COVID, it delayed, and then it's hard to bring my family to the United States because they're old. So those kind of things make me a little difficult to make any plan, and then more concerning. But
so in the future, you're bringing back them to here?
No, I mean they're gonna visit it. They're gonna visit US.
Okay.
Yeah, but I am not planning a wedding. So
Good for you. Good for you. How about the what do you think that the COVID is affecting the patients, residents?
So, I mentioned a bit earlier, I only here in like 3 months, so I don't know the Sequoia residents' previous living life, but I think it's all the same in not only the Sequoias or the whole world. It's the same. So especially the residents in here, they're more vulnerable. So they need a more support of the family, because that's what is actually help for their health, to maintain their health condition, and then also not getting depressed as an older elderly. But because of COVID, situation is getting worse and worse. And then we have to lock down as a states, and the government rules, the policy that makes them a little. I think that makes them a little hard to manage their stress, because they're not used to it, and then they don't know how to do it. So I think that's maybe difficult for them about this really COVID related.
For yourself, what do you do to get rid of the stress from the COVID-19?
I try to not to get a stress from any other things. I'm trying to get think more positive, and then so for example, COVID make my life a little change. Like for example, I cannot eat outside, cannot meet friends, but I try to think other ways to avoid that getting stressed, because this time can be managed by myself, as a good way. So I can study more because I cannot go outside, and then I can exercise more in at home.
You're already so smart. You don't need to study. My goodness.
So I try to do that way to get it, instead of getting stressed or I cannot do this, but I try to find a more way I can do it during the COVID pandemic situation. So yeah, and so I have my girlfriend, so I try to spend more time with her.
Oh, in the United States?
Yeah.
Oh wait, but then marriage is. Are you?
Not yet.
Okay.
I'm engaged. Yes.
Okay. Wow. Okay,
married,
I was getting a little confused about there. Okay.
Yeah.
Oh.
So we have a more we can do the more talk.
I'm the only one who knows about this. Does Casey knows?
I didn't mention Casey. I'm gonna get married, but I will. I think I'll. Yeah.
I feel so special to know that. Actually, I asked that question. Actually, the very last one. What would you like to tell the Japanese nursing students?
So, the only thing maybe I can tell them is being a nurse is kind of a different thing than other. I mean, all jobs are more really important, but nursing is more like caring, I think. So by caring, for my philosophy is I like to assist the residents in returning their highest level of functioning while they're in the hospital. So before they go to discharge, I want to try to do my best, and then warm and compassionate, and then taking care of my family. But I hope the nursing student has that mind every time when they're taking care of it, because maybe when they're doing nursing student, they can hear lots of questions that what kind of nurse do you want to be. A lot of people can say, oh, I want to be an emergency nurse, I want to be a L&D nurse, I want to be like a pediatric nurse. But I want to tell them because maybe you can give them an answer. Oh, I want to be a nurse who is warm and smart, compassionate, that I want to take care of the resident, and that I don't know whoever, whatever I can be, but I try to do my best like that. So I think that mind is just like a more being a nurse, and then once you get to be a nurse, and then you will see when you see the residents actually like getting better to see your eyes, and then that's gonna be really helpful, and then be proud to be a nurse. So I think you can think about that one.
Thank you so much. Thank you.
My language is not a perfect.
No.